Good afternoon from Washington, D.C. Peter Thomas with NAAOP. Wanted to bring you up to speed on the election to the extent that you don't already know, and try to provide some implications on what the election will mean for healthcare policy and for orthodontic and prosthetic policy in the future. First off, Donald Trump won the presidential election with 279 electoral votes and surpassed the 270 needed to do that. So he will become the president on January 20th, 2017. Donald Trump won the Electoral College vote, but did not win the popular vote. Hillary Clinton edged him out by only about 200,000 votes. And with at least 120 million votes cast, that's an incredibly divided result. In the Senate, the Republicans picked up the Democrats picked up one seat. Tammy Duckworth beat Mark Kirk in Illinois, and Tammy, of course, is a very good friend to the O&P community. She's a bilateral amputee. She's been a very strong supporter of O&P policy over the years while she served in the House, and we expect her to continue that advocacy in the Senate. We're very proud of her, and we congratulate her on her win. There are two races in the Senate that are still unresolved, and so right now the Democrats have only picked up one seat. With the two independents that align with the Democrats currently have 47 senators and the Republicans have 51. Two of those seats, again, will be decided in the next several months. In the House, there was a pickup of 6 seats for the Democrats that were formerly held by Republicans. The Democrats had hoped for a much larger number of switches in those races, but because of the relatively populist wave that swept the country yesterday in the election, only 6 seats were ultimately decided for Democrats. What that means for Paul Ryan, the Speaker of the House, is that he'll have a bit more of a difficult time negotiating to try to figure out how to move legislation with a smaller majority. So, what happens to health care? It's clear that the Republicans have wanted to repeal the Affordable Care Act for years. Donald Trump has said this many times. Their intention is to repeal the law and to hopefully replace it with something, although that something is a little bit unclear at this time. Just today we're hearing from Speaker Ryan and from Majority Leader McConnell that they do intend to go forward with an Obamacare vote and to repeal the law. And again, what will come in its place is anyone's guess at this point. We expect it'll be some combination of tax credits for the purchase of health insurance to enable individuals to more easily purchase health care and health insurance coverage, especially those with low incomes. We also expect some insurance reforms in terms of purchasing insurance across state lines and other types of market-based reforms. Whether that can actually achieve the kind of levels of coverage that the Affordable Care Act achieved is really not clear at this time, although there have been some forecasts that suggest that coverage will not be nearly as robust. So, what does this mean for orthotics and prosthetics? It's really tough to tell at this point. It's early. There will be a lame duck session of Congress where the existing Congress will need to come back and fund the rest of the fiscal year for the federal government and make sure the government stays open past December 9th. And that will offer a vehicle to attach other types of legislation to that bill, to that omnibus spending bill, if that's the way they choose to go. We're anxiously trying to move forward our O&P agenda. There are some bills that are being looked at and examined. We're hopeful that they'll move later this term, and to the extent that they don't, we will be right back at it in the next Congress. Thank you so much.